Thank you for taking the time to participate in this interview. So, as we delve into the critical issue of nurse shortages within the NHS in the UK, your insights are invaluable in understanding the challenges and potential solutions facing healthcare professionals today. Hello, Halima. How are you today?
I'm very well. Thank you for having me.
You're welcome. So, could you share a bit about your journey as a nurse within the NHS? What inspired you to become a nurse and also your experience?
Within the nursing field, a lot of the nurses are drawn to nursing due to a deep seated desire to help other people during their vulnerable need
Hmm.
and want to see patients improve their quality of life when within the community. So also there are factors that could also increase their inspiration, which are from personal experience, witnessing compassionate care of nurses or other multidisciplinary team, or even having the personality traits of caring people.
Hmm.
And within the nursing field, the NHS usually has like ongoing education, training, and continuous professional development. And people within the nursing field usually um, try to maintain that and also fulfill the experience of patient care. So, from my personal experience, I witnessed compassionate care when I was young, and that encouraged me to research within the nursing field and wanting me, and in the future, I wanted to become a nurse myself.
Thank you. So, as you work at the Northwick Park Hospital, so how have the staff shortages impacted your work and the quality of patient care there?
So at Northwick Park hospitals, there are many like healthcare, like A&E and wards that do experience staff shortage, even within across the whole country, is a common issue, but it could lead to consequences and affect patients' quality of care. So as a typical nurse, they would usually have one nurse looking after five people. However, if shortage of staffing can occurs, such as a nurse can call in sick,
Hmm.
or less staff members within the team, or an emergency, that can affect the patient and nurse ratio. So if that occurs, that could also increase the risk of stress, fatigue, and burnout, and also affect patients' quality of care due to not having the time to provide the level of attention and support for each patient's needs, as every patient's needs is different.
Hmm.
So, for example, in the medication rounds, one patient may need to give medication for an hour because they might have more medications compared to a different patient. Or then they can't eat or drink, so they have like a peg feed. So that requires more time than a patient who's independent and can eat and drink. But due to this, that can delay care, increase waiting time, and pressure within the existing staff. And
Hmm.
then this could also cause frustration within relatives as they're not expecting the appropriate care that they require.
Hmm. So, referring to that, could you tell us about a specific experience that really highlights the challenges that you face daily due to staff shortages?
So this correlates with the previous question.
Yeah.
Um, it leads to less time for each patient and can also delay medication administration, responding to patients' requests, referrals, providing emotional support. As nurses, we do not just um, give medication. Um, we look after patients' emotional needs, psychological needs, physical needs, and it's that they are at that position where they're very comfortable. And if a staff shortage occurs, we cannot fulfill their needs appropriately and efficiently, which can prolong their hospital stay, which we do not want as as the healthcare profession. And you encourage them to go back to within the community so that they can enjoy their quality of life.
Yeah. So we've heard about the NHS's workforce plan to address the staff shortages. So from your perspective, how effective has this plan been, and what more needs to be done?
I feel like from my experience, there has been days where agencies and bank staffs they come and help within the ward or within the healthcare setting. However, due to the lack of funding of agencies and stuff, and sometimes bank staffs would not go to the wards that they don't like, it can affect the patient care outcome. So um, with the shortage of staffing, it can improve with the recruitment drive, training programs. Um, However, there are some certain factors such as investment in technologies and increasing recruitments can affect the outcome. But from the last couple of years, in one of the surgical wards, for example, they have struggled with staffing and normalized looking after a nurse looking after 10 patients, which is a concern, but that's the reality of the NHS.
Okay. So, how does the NHS's reliance on outsourcing nurses from, agencies, due to shortages affect patient care and the working conditions of the NHS staff?
So relying on agency nurses to fill staffing gaps can have both positive and negative attributes within the healthcare setting.
Yeah.
While agencies can provide temporary solutions to immediate staff needs, um, and however, they may not always prioritize continuity of care within the hospital protocol. This means that some agencies within different hospitals, they have like different policies. So each hospital has their own policies which they follow, and sometimes agencies um, don't follow certain. So they're not really aware of the protocols that the hospital's based, and also it can also affect the nurses within the NHS due to helping the agency nurses as they're unfamiliar within the environment. Therefore, agencies are seen as a short-term solution. However, long-term solutions such as investment in training and career development for existing staff are essential to build a sustainable healthcare workforce.
Okay. Thank you. So yeah, so as our interview comes to a conclusion, I would like to, express my appreciation for your insightful remarks and important involvement in our discussion of how to manage the lack of nurses within the healthcare industry. And your experiences and point of view, shed light on the intricate dynamics at work, as well as the innovative approaches required to successfully overcome such challenges. Once again, thank you very much, Halima.
Thank you for having me.
No worries.